I am Dr. Nanda Rajaneesh. I am a consultant laparoscopic surgeon and oncosurgeon in Apollo Spectra group of hospitals. The pre-op diet that we advise for all patients who undergo gastric bypass surgery would be to put them on a liquid diet at least for 2 to 3 weeks. The reason being, these obese patients who are undergoing gastric bypass will have a very soft liver with the fat filled within the liver. So while operating, the operating area involves one part of the liver which overlaps in the operating area. So what happens if the liver is very soft with the fat, then there is a good chance of injury to the liver. So make the liver firm, we put the patients on a liquid food so that they get adopted to eating liquid diet also one. Simultaneously the liver becomes firm within 15 to 20 days. So this is a pre-op diet that we advise. Post-operatively, there is a definite pattern of diet that we follow. Immediate post-op, we do not give any food for up to 24 hours because we have done anastomosis. Maybe up to 48 hours by some doctors, some surgeons. So after that, what we do, some doctors do prefer to do a study, the contrast study, to look for any leaks. Once the leak is not present in the contrast study, we start a clear liquid diet. After a clear liquid diet, for 3 or 4 days, we start a fruit juice and the liquid diet for a week. After this, subsequently, the diet is very well planned for the individual in such a manner that up to 6 weeks, the patient is under strict diet management and strict vigilance of the dietitian. So later, what is most important when we do gastric bypass surgery is that initially, though we are not giving that much of protein, so sometimes we do give a protein supplements. Eventually, there is lot of protein loss in the body because the food is completely restricted in gastric bypass surgery. So patient receives very less quantity of total diet itself. So the body fat is being utilized for a metabolism. It is kind of keto metabolism that happens in the body. So patients start losing weight, but simultaneously patient starts using his proteins from the muscles to recover that is the usage that is required for the body. So in such situations, muscles can get lax, there may be a hair loss. So it's very important patient receives supplementary proteins adequately, or if he is a non-vegetarian, you can take non-vegetarian soups, which is advised. Most important is what not to eat and what not to do post surgery in the long term. Never eat bread and wheat items as much as possible because it can stretch the gastric pouch. The purpose of doing the surgery may not be served very well. And there are other complex problems that can happen, what are called as dumping syndromes. So avoid eating ice creams, sudden high concentration of sugars, so which will lead to complex complications, and you might have to visit the doctors very frequently if you do not follow the diet very strictly.